Welcome back, guys. My name is Abu Azeez and you are on to the Abu Azeez Podcast. I would like to use this opportunity to thank everyone that has supported this platform, this project, this podcast. To my friends that has been here to honor my invitation to come and share their experiences, their knowledge, their stories, their challenges in their football career. I would like to truly appreciate you for stopping by. And to everyone that supports us with their retweets, reposts, the people that share on all social media platforms, I would really want to thank you so much. Just like you know, the Abu Azeez Podcast happens to be a platform where people that has been involved in football come in to share their knowledge and everything that they have gone through in their football career. On today's episode, I am actually diverting because it is not about just footballers. On this episode, I present to you somebody that I respect so much, but I know we won't use my hand introduce them. So yeah, I go allow my guy making introduce himself, making tell our listeners, our viewers who him be, where him they work, and from there I'll take him up. So my guy, welcome to the Abu Azeez Podcast.
Thank you very much. It's nice to be here. My name is Adeniran Ridwan, popularly called Dr. Adeniran by so many people. I'm a medical doctor, sports medicine specialist, and currently I work for Sporting Lagos as a team doctor.
Team doctor. Good to have you here, doctor. And there are so many things I would like make we discuss, but we're going to take them gradually, one after the other. As a sports doctor, in case some people don't know, in the work with Sporting Lagos, and Sporting Lagos now one of the teams we don't qualify from NNL to the NPFL this season. For the first time, Sporting Lagos go to play for the Nigerian Premier League this season. Before I start, I will say congratulations. Because it's not easy for a team like Sporting Lagos to come from NNL and boom, they don't already the Premier League. I believe say you go see some of the things where we don't see for the Nigerian league, but it will touch you. You go enjoy the league. Nigerian league happen to be a very interesting league. I believe you would have so many stories to talk about. So first and foremost, let's start from this. You have been in the league for a while, or even if you are just coming into the league now. You as a person, you as a doctor, you as a specialist, what do you think say they caused major injuries, or what are the major injuries for Nigeria league, Nigerian players? What will be the major or common injuries them?
Okay, so majorly, thank you for the question. I would like to explain the I would like to explain sport injuries as a total.
Okay.
Then maybe from there I start. I dive into how it's related to Nigeria Premier League or Nigerian football as a whole.
Okay.
So sport injuries basically in layman language is injuries actually injuries that happen during sports, whether you are a MotoGP rider, you do Formula 1, or you play football, or even in swimming, people actually injure. Now, the major causes of this sport injury, majorly, it can be by accident. That's for MotoGP. It can be by accident. It can be by the equipment, the facility used. Like you can get an injury from the equipment in the facility. And it can also be on the field of play. Maybe you're playing football, you had someone hit you, contusion, you have an all. Now then, moving on to basically we can actually classify sport injuries into we can classify it based on the type of injury you have. We can say when you're classifying it based on the type of injury, we have what we call soft tissue injury. and we have what we call hard tissue injury.
Okay.
The soft tissue injury are the ones that actually the major injury to the soft tissue, like ligaments,
Okay.
muscle, tendon, and all. Why the hard tissue injury is basically injuries that has to do with the bone.
Okay. Okay.
Then we can also qualify it on based on severity, how it happened, and all. It can either be acute, that means it's happening.
Much.
Yeah, it's happening now. It just happened now. It happened now. And you take what's it called, necessary things, necessary precaution to actually what's it called, to delay the incident.
Okay.
Then why the chronic one is something that has been on a long term, like the player has had the injury, but there was no proper rehabilitation.
Okay. No management.
Yeah, no management, or the player was just self-medicating, doing all sort of things. So it has lingered on for a while.
Okay.
And the player is still active playing. So for a long period of time like that, it becomes chronic for the player, and it might cause a final blow for the player. Being able to play.
Okay. Thanks for sharing that. And so, as a team doctor in a professional football team that is well run, what are the main challenges you personally have treating a player or managing a player's injury?
Okay. I'll start by saying players are wonderful. Wonderful human being. Like, some of them actually they present to you late. Like as a doctor, while I was doing my my house job, we tend to just sit down in an office and the patients will come to us and tell us what they feel and all. But I noticed when I joined this sports medicine, when I started this sports medicine as well, like, I needed to go to the players to inquire. Alpha, what's wrong? Alpha, what's wrong with you? Alpha, are you okay? Like, you needed to inquire, like, from them, not because most of the time they will have something going on with them, but they won't want to voice out. They prefer actually consulting a fellow player that it has happened to before. Then that one also advises them that, oh, this is what I did, this is what I did, this is what I did, and which has been a very bad has given a very bad side effect to some of the players that has passed through that route. So I would say the most challenging thing is player not consulting at the right time. At the right time, and when the thing is still when whatever is going on is still very fresh. So they don't come out straight.
You're talking about this from what I would pick is that most NPFL players or most Nigerian league players, they do self-medication. Is that what you're trying to say?
Yes.
And from your own angle, how does this self-medication affect or contribute to a player's injury or affect their performance?
So for example, I'll just give you an example. We have some players who don't even know that they have ulcer. They just always have a complaint of I'm having stomach pain, and when you ask them that, since when has this, okay, because I didn't eat, or after I ate, or because I took some drugs. Now you inquire, what drug have you been taking? They will be like, it's Alabukun. After I came back from training yesterday, I was feeling somehow, so I just took Alabukun. And they are fond of taking different kinds of NSAID, which is very bad for players who have ulcer. Or even when you take too much NSAIDs, without the prescription by a doctor.
Can you please emphasize on that NSAID?
Okay. NSAID is simply non-steroidal anti-inflammatory drugs.
Okay.
Mostly they are your diclofenac,
Okay.
your ibuprofen,
Okay.
even the alabukun. The mixture of everything still has the contents in it. So those drugs are really not like for you to start using those drugs. It has to be prescribed to you by a doctor, because you would have asked you for your background history, whether you have ulcer, or if the drug will actually, and if it's not going to work for you, you will find an alternative. But players tend to use drugs anyhow, and it actually affect them maybe on the field of play, maybe when they are having a match like an hour or two, and you just I'm having this leg pain, or can you come, let me just use diclofenac, let me just use diclofenac, so that I'll be I won't feel the pain. I would just go there and perform there, then anything. But when they do that and they start having they start having the pain, they won't be able to they won't be productive on the field of play.
Okay. So far so good. You be sports doctor. You study sports sports medicine, Abi? Okay. And it gets one particular conversation where I dey always want get with either a team doctor or a sports doctor. Why e be say anytime when Super Eagles of Nigeria or foreign-based players them get match, if them come Nigeria, some of this pitch wey dey for Nigeria, those players wey dey play for abroad, them no dey fit play ball. Maybe na the AstroTurf or some of the normal ground. How you feel say the pitch, the pitch itself, our stadiums, they affect player where they bring injuries to players?
That's a very good question and a tough one at the same time. Because I used to tell our team manager about, because before we got qualification, while we were training and recruiting players, we were staying in we're in Ijebu-Ode, using Ijebu-Ode Stadium. So each time we go there to train and all, so I just noticed that most players complain about their knee on that stuff, and it's also synthetic.
Yes.
So coming back, when we come to Lagos to play at Onikon, then they feel different for a while. They feel different, like
they don't normally complain about the
injuries. And both are synthetic. But I noticed the one in Ijebu is kind of what's it called? It was made with tire rubber. Tire rubber. Why the one in Onikon is made with I think sawdust or something like that. So is a story I'm even trying to do, like going forward, trying to do. So I just noticed the turf there was always hard on their knee and all. So I had to just tell the club management that that it's preferable when
you don't even train on that stuff.
The team comes to Lagos and train on it.
But do you also know that majority of the turf or pitch in Nigeria, they are similar to those types in Ijebu-Ode? Do you know? And do you feel those injuries that those players abhor when they play on those pitch affects their performance?
Yeah, definitely it does. It affects their performance, like I won't even like 100%, because a player that has been trying to, there's one thing about Nigerian players, like I told you before, they don't come out straight. They don't. You have to ask them, or when I'm watching games, I just try to see players' movements, how they are, how they do. But when you are
you see a player
when you definitely know a player that something is going on with his leg. Like you are going to, cause the way he plays and you know the player before, this is not what but you will see that deficit.
I understand you.
On the pitch. So when you go and me, Alpha, what's wrong? Can you come? I know you are limping. Don't even try to lie to me. I know you are limping. Like this is not what.
That is when the player will not open.
And then I'm like, my knee don't they pay me, but then I just they use drug. I just they use painkiller. That's what it will amount to, painkiller. Because obviously they have to continue. Because you know now this is Nigeria. They have many people to feed at home. They are playing this football for a reason. They have to feed people at home, and they are fighting for GSC on the pitch.
Because they know immediately they tell the coach that they are injured.
They tell the doctor, and the doctor is saying this one is out for a couple of days. You know that
another person
the coach don't look for
another
other means. Do you understand? Say okay, since this one no wala. Another person, and you know the thing about this football thing is, if you get injury, there's someone waiting for you on the bench.
Yes, now
to come on. Yes,
take your shot.
And if the person actually plays better than you, like that bench is your home now. Like, so do you understand? So players are mostly scared. They are mostly scared about being benched and being vocal about what is going on.
Them being injured.
Yeah.
Now we have talked about how the pitch or turfs, how they affect a player's performance. Now there is something else I also want to hear your own side. Many NPFL players, they usually complain about this long distance journey going for a match. You'll see a Nigerian Premier League team going for a match and they are inside the bus for 13 hours, 12 hours straight, and they are playing maybe the next day or the following day. And if they finish playing, like they play on a Sunday, on Monday they are back inside the bus. Some team even travel immediately after their match to cut their journey short. So players has been complaining that this long distance journey affects their performance, makes them injured. You as a team doctor, what is your view? What is your opinion? What is your suggestion? What is your 2%?
This is Nigeria. Yeah. The long distance thing is actually is really a big problem, like a very, very big problem, because I understand the whole jet lag thing. Because when you say when a player is supposed to play this Saturday in a particular, let's say for instance, the player is traveling to the northern state to play. He's going to play on Saturday. And the player has another midweek game
on Wednesday, the following Wednesday.
So after you play that Saturday, you have to travel back to your own base
to Lagos on Sunday.
Do you understand? Like let's even say on Monday.
Okay.
Now you've spent like 2 days on the road. Let's say you're going by a bus. I've not experienced that.
You go experience this one.
I've not experienced that.
But you go just experience some. As in, I don't enter NPFL now.
No, we are Sporting Lagos. Have you heard of us? Have you heard of us? We are Sporting Lagos. Don't worry. So the players would have to come back for the midweek game. Now I just think about it, because as I hear about it, I just think about it like, how do these guys do it? I know there is always the thing about Nigerian blood. You're an African man. Please.
Okay. Do you also let me come in? Do you also know if a team plays on a Saturday and they have a midweek game on Wednesday, if they manage to get to their base like on a Sunday night or a Monday on Tuesday they still train. Do you know?
Yes.
And many of the things that I know of, instead of just doing recovery, in football there is what we call recovery. You just finish the match, you are supposed to do a normal recovery process.
Yeah.
Some things still go on endurance training a day before the next match. This is your line, this is your job. How do you think this affects the players' performance? How does this bring more injuries to the players?
A whole lot. Like, it affects them a whole lot. Because I can't even imagine the fatigue that would have accumulated in the players. Like, that one is 100%. Accumulation of fatigue would surely happen in them. Some of them are just doing. They're just. Do you understand? They are just being like, no, this thing. I get game. We guys play. I have to be in the team. That kind of thing. But I believe going forward, I believe sponsors and what's it called? They can work on sponsors.
We would come to that. We would come to that sponsor. So, talking about players' injuries, we have talked about the journey. We've talked about the pitch. One other thing that I want to get your own opinion about is, does a team training twice a day, does it in any way relate to what causes injuries in players? This is your line, this is your profession. I just want to get your own 2%.
Okay. I understand that teams always teams always want to be their best and at their best every season, here and there. Coming to your question, you said
does for a team that trains twice a day, does it in any way relate to why players are always getting injured?
Yes, very, very much. Because okay, if you, let's say for example, if you want to train twice a day, you obviously do one in the morning, then you want to go later in the evening.
Yes.
To do another one. Okay. Note that the one in the morning is very early in the morning. Players are just waking up from sleep.
Yes.
And most of them are not yet refreshed when they come to the pitch and do what they want to do. Then they go back to their camp, they sleep. Then in the evening they come back for another training. Like, the interval for them to get a proper rest is not there. And your body will tell you. Body go tell you. It go tell you. There's no African man, African blood anywhere. Body go tell you. Right? I used to say, okay, if it is during if it is a pre-season, yes,
it is understandable.
Yeah, it is very understandable. Yes, you can just to. But then maybe during the season, that is unrealistic for me.
Okay.
It is very unrealistic, for a team to be trained twice a day.
Okay. In an on season.
On season, and you're going to be playing 38 games.
You know why I want to agree with you. I have been in a season in a club where, if we are going for the morning training, we have to get to the field like 7:30 in the morning, and we start training by 8. And if we start training by 8, we don't finish till like 10:30. After 10:30, they address us, they talk to us, then we leave. And as early as 3, we're already up, getting ready to come to the field again. Training starts 3:30 or 4 o'clock again. That's why I agree with you that we are not getting a lot of rest. So I think I truly agree with you. But another thing I also want to know, and I would like to, since this is your line, now you're going to teach me, you're going to teach my listeners, you're going to teach my viewers. For a player in this Nigerian league that plays 38 straight matches. And those 38 straight matches happen to be almost 90 minutes, 90 minutes, 90 minutes. Is it possible for that player to be at the very top? Or is it also possible for that player to be getting closer to injury?
I think this is for the player, like it's a motivation for the player himself, like he motivates himself, because there are a couple of things attached to it. First thing, a player has to be very disciplined.
Discipline in what sense?
A player, okay, discipline in the sense that, okay, you have a training in the morning. You know you are training in the morning. You already know that in your head, the psychology is there. I'm training this morning. You get up early, go to train, and or when you come back, you do the necessary things you want to do. Maybe you want to shower, wash and all, then have a good rest.
Okay.
Do you understand? Anything you might have in, or maybe you are treating something with by the doctor's prescription, you can go ahead, then just then most importantly take that rest. But some players would, when they come back from training, they do all the necessary things. They are always moving about, like, and not trying to, like,
give the body a proper rest.
You understand? Give the body a proper rest. While some players also, still based on discipline, some players also tend to, like, go out of their way, just going out and drinking, doing all sort of things.
I want to know the all sort of things.
Drinking, having sexual relations outside, when you know that all this would actually tell on you on the field of play.
Yeah, we've talked about the common injuries in the Nigerian Premier League. We have talked about the stadiums, the turf, the pitch. We've talked about the long distance journey. We've talked about the training times in the Nigerian league, where they mostly they let player they injure. But again, one particular one where I want to know. So many people, I don't know, maybe in a mindset, mentality, but from within I hear from doctors, team doctors, then they advise them players. If the player gets injury, they normally tell their players that if you are injured, don't have sex. So I don't know if it is a common mentality or it is your profession or your line for you to educate a player that way. So I want to know, because this is your line. I need you to educate me.
Okay. So based on the question, I do hear that a lot, and I think sometimes I don't actually have a concrete answer for you, but then I hear a lot when players go to most likely bone setters. They tell them don't have sex, don't do this, don't drink cold water, and all.
Yes.
Then which now prompted me to start try to read the medical journals and all. But there are some medical journals that has talked about wound healing and issue of sex, maybe due to the hormonal whatever that comes to play when after having sex or during sex. You understand? Maybe it prevents wound healing and all. So it's still not a thing of a fact for most journals I have read. But me, I won't advise a player to a player that is playing during the season, not even an injured player that is playing in a season, to be engaging in such, because before you can even have injuries from sex. I'm not even talking when you're like when it's going on. The excitement is a lot. You can pull an hamstring. Yeah, you can pull a muscle while having sex, and you have a game tomorrow. So how would you do you understand?
Hamstring.
So
as a team doctor for a professional team in the Nigerian Premier League, what role does a team doctor play in this? I have seen a team where a key player is being injected just for him to play a match. because the management, they feel that this player is very, very important, and then get match, the player get injury. What role do you as a team doctor play?
Okay, the issue of injecting a player to those are part of the drug mismanagement and lack of professionalism doing that. Because if a player is actually what's it called, injured, and is so important to the team like that, I think measures would have been taken to prevent the issues around whatever we know there are some that are sudden that you
yes,
but still don't take all those kind of things into your own hands. Like it's unethical for you to inject someone now to go and play. Given the fact that it depends on the kind of drug you are injecting him with. Like you are injecting with any drug now and you want the player to go and play. If I inject someone, I want you to go straight to your bed and go and sleep. Do you understand?
Yeah, I get
so I feel is part of the drug mismanagement among. It's really unethical for me. That's what I must say.
Okay. I would like to know something, and what I want to know is, if a player is being injected, who we suppose blame? Now the player himself, or the coach, or the team doctor? Who we suppose blame?
I feel for that kind of thing to happen, for a team doctor to have injected, taking it upon himself to inject a player that is supposed to be a starter, that kind of thing. Maybe the pressure would have been much, but there's no pressure. No pressure can be that much to place on the doctor, because you as a person, before you started being being their team doctor, you as a person, you have something to protect. You have to protect your license. You have to protect everything, your own image, because anything can happen. You inject someone, is going to the pitch to run up and down. Anything can happen. Anything can happen. So, speaking for the team doctor, there's no amount of pressure
that should make a team doctor
should make you make that decision. Yeah, make that decision.
Okay. So there is this mentality from some, not all, some Nigerian league players that before a football match, they take energy drinks for it to give them strength. I have also been in contact with a professional player in the Nigerian league that would chew Bitacola, Orogbo, and Tom Tom. I now started asking the guy that, what's in this one they do for you? He told me, they give me strength, they give me energy. You as a team doctor, what are your sentiments? What are your opinion? What is your suggestion? What is your 2% on these two energy booster which some people they take?
So I think it was during the Super 8. We were giving some energy drinks as what's it called, as souvenir during the marathon, or I don't know. So I think the energy thing. I told the players, I told them not to take it. Like it's not good for them now when they are going to the pitch or anything. It's not good for them. They want to play match, and you play every day, constantly, every day. Do you understand? Now, what energy drink does to a player is, would the energy drink make you run faster? Make you run? Yes. With the energy drink, will it make you be active, like just very active on the pitch? Yes, it's going to make you. But what about the decision making? When your head and your leg are not calculating together, maybe you want to make a true pass for someone, and you want to make a true pass for someone, and you just decide to just make a pass that is actually not true. Do you understand what I'm saying? Like the thinking aspect, because the energy drink actually it contains a lot of caffeine, which actually affect the player, because it will make you wide open. But at the end of the day, there is some accumulation of fatigue that will happen, because the energy drink will not make you sleep when you are supposed to rest. Let's say you are having a match tomorrow, you are playing a match. There are some matches in Nigeria that will play today. You play now, you play tomorrow, that kind of thing, and you are taking energy drink. You won't get that actual sleep you are supposed to get to make you refreshed for the game you have tomorrow. Do you understand? So that is where the coordination comes in. You will run, you can run faster than a cheetah. You will run, you will do everything, but then the thinking part, because your brain will be tired. Your brain will be tired. So decision making is more of football than kicking, because you have to decide, do I want to pass this ball to this person? Is this person available for me to pass? So decision making, it would be affected, would be impaired.
That's true.
Do you understand? So will it make you run? It will make you run. You run the whole pitch, and your eyes will be wide open. You go run tire. Your body go tell you later.
Before we finally conclude this episode, I would like you to share how you feel the Nigerian League can reduce injuries in the league. What are the things you think we can also do to avoid injuries? I know injuries are normal in football. It is a normal something. But there are some injuries that you think we can avoid. What are the things you think we can do to avoid or reduce injuries?
Yeah, a lot of things, but then I'll just talk about some few.
Okay.
The ones I can remember.
Okay.
First being that adequate equipment should be in place.
Okay.
When you are meant to stretch, you stretch. When you are meant to stretch, you stretch. When you are meant to warm up, you warm up adequately. Like you do it, like it's part of the job.
Yes.
If you don't warm up properly, you don't prepare your muscle for what they want to do, or exactly, there's going to be problem. There's going to be problem. So I will just implore them that when it's time for warm up, you warm up, and there's a way you actually, it is a process of introducing your body to getting set. Of you walk a little before you start jogging. You walk a little, then start jogging, then you stretch.
Okay.
When you are done, the same thing. Walk a little, jog, then stretch, like that.
And then you're telling your body that it's ready.
Yes, do you understand? Then issue of weather also, we know how harsh it can be in the up north, the sun and all. Some people are used to it, but people that are going there are not really do you understand? I feel some things can be done. There's no how you can predict the weather, but then if it is actually when you are building stadium, you put into consideration about those effects, the weather effect and all. Then also, what else? I feel also the NPFL can also increase the number of players in a squad.
Okay.
To be registered, so that they can do you understand, score depth, and they'll be able to shuffle between players, because
weekend and midweek.
It's 38 matches, my guy, and it's a whole lot.
So basically, what are some of the recoveries or the recovery programs that your team, Sporting Lagos, that they do that might be different from what other teams in the NPFL don't do?
Okay, it's basically for our recoveries, we do majorly low intensity exercise and high intensity workout.
Okay.
Low intensity exercise mean being that just little warm-up, shake-ups, jogging and all. Then the workouts, you go to the gym, you build your muscles, and we rest. And we also do a little of swimming, like organize the boys to go to the pool, swim, and also including massages, for just the body muscle to come back to its physiological state.
Yeah, I think that's good. Before I finally round up completely now, why we say many ex-internationals where I don't see, that time when they don't stop ball, then they always get knee injury. It make me remember one of my big bros, Andrew Randa. Anytime we go play ball now, he must get knee injury. Waiting they cause some way people we don't the age. They always get knee injury now.
Yeah, it's the age is a risk factor for them. So most of them develop arthritis, osteoarthritis after after they've gotten a certain kind of age. You understand? Arthritis. So it's majorly due to their body formation and their age. So it's just
like this now, before I will come to the end of this show, I feel say Bros Andrew Randa, they say you don't age and you don't get arthritis, so you need to see my doctor. So finally, I don't come to the end of this episode. It was nice having you, and I did very, very happy. But now you go use your hand, sign out, and the only way you can sign out is for you to just greet our viewers, greet our listeners, tell them to watch our episode and make them subscribe to the Abu Azeez Podcast on YouTube. And we say goodbye.
Dr. Adeniran, Team Doctor, Sporting Lagos FC. Thank you for watching this beautiful episode. I hope you've been enlightened. I would like you guys to follow the Abu Podcast on all social, on YouTube, like, follow, share, and subscribe. Thank you.
Peace out.